High blood sugar isn't the only enemy. Oxidative stress silently damages nerves, eyes, kidneys, and blood vessels every single day. The right antioxidants help you fight back. Steadier glucose, calmer inflammation, stronger energy, slower wear and tear. Today, you'll learn the top 3 most effective antioxidants for diabetics, how to get them from food, when supplements make sense, and smart ways to combine them for real-world results. 1. Glutathione, your master shield. Your cells rely on glutathione to neutralize free radicals and clear toxins. Diabetics commonly run 20 to 40% lower due to higher oxidative load and faster depletion. When glutathione is low, you feel it. Brain fog, stubborn fatigue, slower wound healing, worsening neuropathy, stiffer arteries, creeping blood pressure, and mystery plateaus in weight loss because mitochondria can't burn fuel efficiently. Why it matters for blood sugar. Glucose metabolism produces oxidative byproducts. Adequate glutathione protects pancreatic beta cells, helps insulin signaling work properly, and tamps down chronic inflammation that drives insulin resistance. Food. First, make it daily. Sulfur-rich proteins, eggs, beef or chicken liver periodically, wild salmon, alliums and greens, garlic, onions, asparagus, spinach, okra, avocado, selenium partners. Brazil nuts, 1 to 2 nuts a day, helps glutathione enzymes. Quick upgrades, lightly cook, or enjoy some items raw to protect fragile antioxidants. Pair with vitamin C-rich foods, peppers, citrus, kiwi, to help recycle glutathione in your body. Supplement options when food isn't enough. Unacetyl cysteine NAC, 600, 1-800 milligram per day in divided doses supports glutathione synthesis. Reduced glutathione bioavailable forms 250 to 500 milligrams day. Take with water, away from heavy meals if you get mild nausea. If you have asthma or use nitrates, review with your clinician first. Daily routine idea, simple and tasty. Breakfast omelet with spinach, mushrooms, garlic, and avocado. Midday water plus NaC. Dinner of wild salmon with lemon and herbs. A single Brazil nut as a mineral top-off. What to avoid? It drains your shield. Ultra-processed sweets, frequent alcohol, deep-fried foods, and constant seed oil frying all push oxidative stress up and glutathione down. 2. Vitamin E. The membrane. Bodyguard. Think of vitamin E as the protector of your cell membranes and blood vessels. It intercepts lipid peroxidation, the rusting of fats that worsens insulin resistance and vascular damage. Diabetics use up vitamin E faster and often absorb fat-soluble vitamins less efficiently. What you may notice when it's low: more anxiety or low mood, heavier midsection, weight gain, sluggish recovery after workouts, tingling or numbness that's easier to provoke, higher blood pressure readings, and drier eyes or vision strain under bright light. Best whole food sources. Build them into meals: nuts and seeds, sunflower seeds, almonds, hazelnuts, raw or lightly roasted, avocado, half a fruit boosts E and provides healthy fats for absorption. Fatty fish. Wild salmon brings vitamin E plus omega-3 south to calm inflammation. How to eat for absorption. Vitamin E is fat-soluble. Pair E-rich foods with olive oil, avocado, nuts, or salmon for better uptake. Keep cooking. Gentle high heat can degrade it. Supplement basics if needed. Look for D-alpha-tocopherol, natural form or mixed tocopherols. Typical supportive range, 200 to 400 IU per day. Some use more short-term under supervision. If you take anticoagulants, get a green light from your clinician before starting. 1 plate template: salmon fillet with lemon and herbs. Side salad with olive oil plus toasted sunflower seeds plus sliced avocado. That's vitamin E, omega-3 south, and fiber in one move. 3. Vitamin C. The spark that regenerates others. Vitamin C directly quenches free radicals and recycles vitamin E and glutathione. amplifying your antioxidant network. High glucose competes with vitamin C for cell entry, so diabetics often run lower intracellular C even when diet seems okay. When you're running low, easier bruising, slower gum or skin recovery, persistent fatigue, heavier cravings under stress, mood dips, and more pronounced nerve zinging after long walks or standing. Best low sugar. Whole food sources. Bell peppers, raw or lightly sautéed. Broccoli, kale, kiwi, guava. Citrus is fine in modest portions. Squeeze lemon lime over meals for a sugar-light boost. Keep the C you eat. Vitamin C is heat-sensitive. Enjoy raw or lightly cooked. Add it to protein and fat-containing meals. Eggs plus peppers, fish plus lemon for balanced glucose response. Supplement options. Liposomal vitamin C, 1,000 to 2,000 milligrams per day, often gentler on the gut. Higher uptake. Standard ascorbic acid or buffered forms if liposomal isn't available. If you have oxalate kidney stones history, discuss dosing with your clinician. Diet Life Upgrade, mid-morning. Kiwi plus a handful of almonds. Lunch, chicken avocado salad piled with raw peppers. Dinner, wild salmon with lemon and a side of quick. Sautéed broccoli finished off the heat with a splash of citrus. How to stack them for results. The ACE Stack Daily, antioxidant backbone, vitamin C with meals. Food plus 1,000 milligrams supplemental if needed. Cell membrane guard, vitamin E via nuts, seeds, avocado, or a 200 to 400 IU supplement. Engine room support. NAC for glutathione, 600 to 1,200 milligrams per day, or reduced. Timing cheat sheet. Morning, vitamin C plus breakfast. Earch nuts seeds as a snack. Midday, NAC or glutathione away from heavy food if possible. Evening meal, fish, greens, avocado. Finish with raw pepper slices or lemon. 2 habits that multiply the effect: 10 to 15 minutes of walking after meals. Pushes glucose into muscle with less insulin. Hydrate with mineral water. Magnesium helps calm oxidative pathways. Safety. Interactions and personalization. Blood thinners. Vitamin E at higher doses may increase bleeding, risk clear at first. Kidney disease. Review vitamin C dose and overall mineral load. Asthma or ulcers, NAC, can be mildly irritating for some. Start low. Allergies or intolerances. Rotate food sources. Supplements can fill gaps. Track fasting glucose. 1-2 to our post-meal values. Energy, sleep. And neuropathy. Symptoms, 448. Week sedge doses. Food sources based on your trend, not a single day. Closing. If glucose is the spark, oxidative stress is the wildfire behind complications. Building your day around glutathione support, vitamin E, and vitamin C gives your cells real defense. Steadier numbers, calmer nerves, clearer energy. Start with one upgrade today: peppers with lunch, almonds at snack, NAC at midday, then layer in the rest. Your future self will thank you.